All the examination points that we discussed in the previous presentation of the examination of the year. So all those points we should confirm with the help of the otoscopy examination. So we'll be seeing the wall of the external canal. In the wall of the external canal we should see for any swelling. The most common swellings are this furuncle, it can be, but it is in the only outer part of the cartilaginous part of the external canal. Then we should see for any osteoma swelling, again they are not that rare, we can see sometime. And then the content of the external ear, normally the content of the external ear should be air, there should not be anything except air. But in some of the patients you can see the wax, you can see the foreign body, we can see some discharge, we can see even sometimes insects also. So these things they should be removed because they will come in the view of the tympanic membrane. So they will not allow us to see the membrane. So ideally when the discharge is there, it can be purulent discharge, it can be mucopurulent discharge, it can be little watery thick clean discharge, it can be even blood also. The discharge can be mixed with blood, that is called serosanguinous discharge, it can be. So whatever is there in the external canal, we will have to clean that. And after cleaning, then we can see the tympanic membrane. So in the tympanic membrane, we should see the position of the tympanic membrane, whether it is retracted, whether it is bulging, or whether it is in the normal position. And before seeing the abnormal, then you should remember all the normal conditions also, normal conditions of the tympanic membrane. We should be able to see the cone of light, under of the malleus, lateral process of the malleus, anterior and posterior malleolar fold, ambos, all these structures we should be able to see. So if there is any perforation, then the size of the perforation, site of the perforation, whether it is central type or it is marginal type, that is discussed in the previous our examination of the physical examination of the year. All these points already we have discussed. And then the tympanic membrane, sometimes we can see the tympanosclerotic patch. So what is patches, if they are there, that we should note and that we should document also in our case history. So tympanosclerosis is quite common. In that we can see the whitish patches, chalky whitish patches in the tympanic membrane. In today's clinic, I will show you the exact method of examining doing the otoscopy. In the otoscopy examination, we will be examining the external aortic canal and tympanic membrane. And if the tympanic membrane is very thin or if it is perforated, big perforation is there, we can see some part of the middle ears. So otoscopy examination provides us good illumination, magnification also. So this is the otoscope, and you can see this speculum, ear speculum. Now this ear speculum should be taken as the largest whichever is possible that can go easily into the external auditory canal. And we should keep in mind that this tip of the external speculum should not touch the bony part of the external canal, because the bony part is very, very sensitive and it will be painful and patient will not allow, and especially in children they will shout. So this tip should not go beyond the cartilaginous part. It should remain only up to the cartilaginous part. That we should take care. And if you are examining the left side of the ear, you will have to hold it in our left hand. And if you are examining the right, then we will have to hold it in the right hand side. The light you can see, it is bright light, and then you can see this lens. It provides us the magnification. It's about 2.5 times magnification that we can see. These are switch of on and off. And this handle, it has this battery power. So inbuilt power is there, inbuilt light is there, so it makes the examination very smooth. And let us now first examine the left ear of the patient. So I am holding it in my left hand, and it should be hold it like a pen, like this. We should hold it in this way. Okay, and this little finger should touch the patient's face, and with the right hand we will be retracting the pinna. After retracting the pinna, then we should introduce the tip of the ear speculum. And because if our little finger they are touching the patient's face, so the patient moves, so along with the movement, that movement even otoscope also moves, so that no injury will occur to the patient. Otherwise, if it suddenly moves and if you not have control, if they are not moving in unison, then that can lead to injury to the external auditory canal. So now, this is the left ear of the patient, and I will retract it with my right hand again superiorly, posteriorly and laterally, and then we introduce the otoscope. I can nicely see the tympanic membrane. I can see the handle of malleus. I can see the cone of light. Is the grey colored semi-transparent membrane. I can see the lateral process of the malleus, Schaffner's membrane, membrana tensa, flaccida, umbo. So all these structures I can see very nicely. For the right hand, we will have to hold it in right hand like this. And with the left hand, we will retract the pinna. So again, pinna should be retracted superiorly, posteriorly and laterally. In cases of children, it is retracted inferiorly. The rest of the direction they will remain same, but for children, it should be retracted inferiorly. But in the adults, again it is posteriorly, superiorly and laterally. Again, I can see the tympanic membrane very nicely. There is no perforation, there is no granulation, there is no retraction. The color is normal, placement of the normal, there is no bulging, no retraction. So this is one method. There is another method in which also you can hold. In some of the books they say that you can hold it like this, and then again you have to retract the pinna and we can introduce it in this way. So both the methods, whether you hold it like this or you hold it like this, they are correct method. So whichever is convenient to you, that we can use.